So that's a brief overview about COVID-19. We now have Dr. Edward Sharif, who's a data coordinator and an epidemiologist. He's going to talk to us and share COVID by the numbers.
All right, good evening. My name is Edward Sharif, and my aim this evening is to talk about COVID-19 numbers, basically statistics relating to COVID-19. Um, as we all know, there's not a shortage of data on COVID-19. Everybody is providing data on the infection, and my aim really is to help people understand how to interpret the data and how to make informed decisions in relation to prevention, because ultimately the fight against COVID is, it lies with the individual. The individual has to decide what to do. So next slide. So it is important that when we look at the COVID numbers, that we understand that these are individuals just like us. So any one of us could actually be in that statistics. So maybe if you look at it from that point of view, it makes the situation important. So basically, globally, we're approaching 8 million cases and close to 500,000 people dead from COVID-19 all around the world. Next slide. And this is Sierra Leone. In Sierra Leone, where I believe everybody on this call is from, we're looking at 1,000 cases, a little over 1,000 cases and 51 deaths. Next slide. And in the UK, where we also have a lot of Sierra Leoneans, it is a little less than what we have in the United States, but it is up there. So next slide. And here we have the United States. So currently we are sitting at 2 million, a little over 2 million cases. So this is about 27% of the global cases. Of all the cases in the world, we account for 27%. Now, I don't know how many countries are in the world, but that's a huge proportion just carried alone by the United States. And we are way over 100,000 deaths. Next slide. So now let me talk about the numbers that we see on the news and how to maybe interpret what we're seeing in terms of the spread of the virus. So when we use numbers to interpret or to do surveillance on a specific disease, sometimes people present cumulative cases. So let's say from February 1st all the way to June 12th, the daily number of cases are added up to get the cumulative number of cases. So basically, this is the magnitude of the problem. This is how many people you have with COVID-19 or who have gotten infected with COVID-19. Now, some people recover and some people, unfortunately die. But understanding the magnitude is important. But from a public health standpoint, we want to see how the disease is spreading so we can take measures. And so it is important when you look at the numbers on the news, you have to first ask, are they presenting cumulative cases? Are they adding the cases as we go? Or are they presenting daily number of cases? So what you're seeing on the screen is the daily number of cases. So these are the new cases per day in Georgia, the state where I believe most of the panelists live, including myself. So what you can see the daily fluctuations in the number of cases. It's not the same. Even though we have new cases every day, the number of new cases and the pattern is completely different. And this can be due to the number of tests that is being performed a day, because for a virus like COVID-19, you have, it is very transmissible. So if you're looking at the daily cases a day, it gives you an indication of how well your preventive measures are working. Are the number of cases gradually going down, or are they increasing as we go along? So it is very important that we look at the spread of the disease in relation to the total magnitude of the problem. Because from a public health standpoint, we don't want people to catch the disease. We do worry about people who've already caught the disease, but once you've caught the disease, we're trying to prevent you from spreading it to another person. So next slide. So basically, overall, the numbers do not tell the whole story, but you wouldn't have a story without the numbers. So it is important to not just look at the number of cases, you have to take the population of the geographic location into consideration, because two locations can have the same number of cases, but when you look at the rates per population, per 100,000 population, you have different rates because of the population size. So when you look at the numbers, also try to take into consideration the age distribution, the sex distribution, because as we've seen, the racial distribution, as we've seen, all these things play a role in in not just acquiring the disease, but also in the outcome of the disease. Next slide. For example, here's France and Peru, two countries with close, almost. You can compare the number of cases per country, but when you look at the case rate per 100,000 people, you have a completely different set of numbers. 286 compared to 624, which is almost more than half. So basically, the numbers do say something about the magnitude of the problem, but relative to other locations. So if you want to compare two places, it is best to take the population of those two places into consideration when interpreting COVID-19 numbers or any other disease. Next slide. And basically that's it for the numbers. We could dive deep, but if you have any questions later, I'm willing to answer any other questions. Thank you very much.